দেশ বিদেশ, জাতীয় আন্তর্জাতিক, রাজনীতি থেকে খেলা, শিক্ষা থেকে সংস্কৃতি, সব খবর পেতে চোখ রাখুন শুধুমাত্র নিউজ প্রাইমে। আমরা সত্যি লুকোই না, আমরা সত্যি দেখাই। সাবস্ক্রাইব আওয়ার চ্যানেল ফর ফার্দার আপডেটস।
নমস্কার, নিউজ প্রাইমে আপনাদের স্বাগত। আমি সঞ্জয় রয়েছে আপনাদের কলকাতা প্রেস ক্লাবে, যেখানে আজ অ্যাপোলো হসপিটালস চেন্নাইয়ের উদ্যোগে এক অভিনব আয়োজন করা হয়েছে। কি সেই আয়োজন? না, 42 বছরের যে সদর্থক পদক্ষেপ অ্যাপোলো হাসপাতালে, তার উদযাপন এবং কিছু নতুন ঘোষণা। এই অ্যাপোলো হসপিটালস চেন্নাইয়ের যিনি সিইও ডক্টর ইলাকুমারান কালিয়ামূর্তি, কথা বলে নেবো তার সাথে। স্যার, ফার্স্ট অফ অল, ইউ আর কর্ডিয়ালি ওয়েলকাম টু আওয়ার চ্যানেল নিউজ প্রাইম।
So much.
Sir, how do you see that Padma Bhushan Dr. Pratap C. Reddy founded before 45 years a milestone in healthcare system like Apollo Hospitals in 42 years of legacy carrying in health service today?
Dr. Pratap C. Reddy, our chairman, is a visionary. 42 years ago, he started Apollo Hospitals only for one reason. He doesn't want any Indians to travel abroad for medical care. Today, he has achieved what he has dreamt 42 years ago. Not only he has stopped Indians traveling abroad to get treated, he has brought in many patients from multiple other countries to get treated in India. People are traveling to India from more than 150 countries. That's what he has achieved in the last 42 years by establishing many hospitals across the country. And also, whatever is the best technology in the world, he is able to bring in to our institute. The good example is robotic surgeries. I have been speaking about robotics a lot. If you take a proton therapy, he has brought in proton therapy first in South India to Chennai long back. That itself shows how the Apollo Hospitals vision is to bring in high-end technology to treat patients.
Sir, as we know, Apollo Hospitals used to offer modern healthcare system to the patients. Sir, as we know, there are one Apollo Hospital in our state, but nowadays we are looking that other hospitals group is acquiring all the hospitals to give the hospitality to the patients. But sir, how can it possible one Apollo hospital in eastern region can afford all the patients who need or who seek to get health care from Apollo hospital?
See, Apollo Hospital offers something unique. The technology, of course, whatever is the best we are able to get on board. Again, this comes with compassion and empathy. I think if you mix patient care, compassion, empathy along with technology, Apollo has got that kind of combination, learned that combination well. That's the reason people are able to come to Apollo hospitals to get treated. Apollo Hospital also started a hospital in Kolkata. As I said earlier, the local hospitals has advanced in offering medical therapy in a big way in the last few decades. I think it's hats off to all the doctors and healthcare providers of Kolkata for achieving that status. If there are 100 kind of problems, still a minimal percentage, say 4, 5 or 10% of the problems, still patients have to travel outside to get treated. Maybe 15-20 years ago, 30-40% of the patients have to travel outside the state. Now that number has come down significantly. Very less number of patients are traveling outside the state. I am sure that will also get stopped in the future. Maybe 5-10 years down the line, most of the therapies, most of the treatment will be available locally. Patients can go there.
Perfectly said, sir. But when their bed numbers is limited, then how can offer Apollo hospitals to the major section of the society healthcare system, modern healthcare system, especially in West Bengal or eastern region?
I think Apollo has got a big vision in terms of developing newer hospitals, not only in Chennai, in multiple other hospitals. Maybe if you look at what's happening across the country, the roadmap and mission is bigger. I'm sure there are possibilities that we might develop more facilities in West Bengal in the future to cater patients locally.
My last question, sir. As we know that there is a system CSR called CSR, Corporate Social Responsibility. In this connection, Apollo Hospital also offers some CSR provide to needy persons, needy patients. But sir, in eastern region, I think this number is very minimum. So what about your mission and vision about CSR project? Because a person who is from a low poverty level also the fundamental right to get the modern treatment from Apollo Hospital.
I think that's a very good point to address. That's one of the vision for our chairman also, to provide accessible and also affordable care to all level of population. That's one of the main thing. So if you look at, I'm just quoting some examples. Say we are getting more than 15,000 patients from the eastern region, including West Bengal, per year to coming to Chennai. Most of the patients are middle class or below middle class. I think if you look at the richer community, that number may be a small percentage. That itself shows Apollo hospitals are committed to offer service at all level, all socio-economic population in this region. One is CSR funding. If you look at our pediatric in children cardiac surgeries, we do thousands of cases at free of cost for many of the children, even from West Bengal and also from northeastern region. We have also partnered with many corporate companies from this region, including Coal India. Many corporates offer a competitive pricing to offer a solution for the people working in their company. And some patients coming to Chennai to get treated, we offer huge discounts. We don't want them to return back without getting any treatment.
Sir, is there in Calcutta, Sastosati is applicable to Apollo Hospitals, Calcutta?
Which one? Sorry, can I repeat the question?
Is there the health scheme of West Bengal government, Sastho Sati scheme, is applicable to the Apollo Hospitals, Kolkata?
I have to check actually, because I'm not covering Kolkata hospital, so I have to check about that actually.
What is your message to the viewers of News Prime via this channel?
First of all, I wanted to thank the people of Kolkata for trusting Apollo Chennai for more than 40 years. I want to thank the partners, doctors for your trust in us. At the same time, I also feel so happy to see that how the healthcare has tremendously grown in this city and in the state in the last few decades. Most of the treatment and therapies are available locally. Still, there is a need for people to travel outside Kolkata until the treatments are available locally, and we are there to help people of West Bengal. Yeah, whenever they want to travel, we are there. We are your friend. We are your family member. We are happy to help.
অর্থাৎ যেমনটা ডক্টর ইলিয়াকুমারান কালিয়ামূর্তি জানাচ্ছেন, যিনি চেন্নাই অ্যাপোলো হসপিটালের সিইও, তিনি জানাচ্ছেন যে বাইরে যাওয়ার কোনো প্রয়োজন নেই, সমস্ত রকমের আধুনিক চিকিৎসা ডালি নিয়ে অ্যাপোলো হসপিটাল রেডি আছে, আপনাদের শুধু আসার অপেক্ষা। অর্থাৎ যদি কোনো শারীরিক সমস্যা হয়, শাট ইউর আইজ অ্যান্ড গো টু অ্যাপোলো। অল কাইন্ড অফ treatment, and not only treatment but also modern treatment you can get in under one roof. নিউজ প্রাইমের জন্য সঞ্জয় সাহা, কলকাতা প্রেস ক্লাব।